One of the most debated issues here at ESMO 2016 in Copenhagen is the debate on left versus right-sided metastatic colorectal cancer. There's a few things to remember. Number one, we do know, and we've known for a long time, that right-sided colon cancer is systematically different from left-sided colon cancer. Right-sided colon cancer is more frequently BRAF mutated, more frequently PIK3 mutated, has more frequently a mucinous histology, has a higher propensity to metastasize to lymph nodes and the peritoneum. So right-sided colon cancer is systematically different from left-sided colon cancer. Number two, we do know that the prognosis of patients with a right-sided primary in the metastatic setting is significantly worse compared to those patients with a left-sided primary cancer. Now, the entire hype, left versus right-sided metastatic colorectal cancer, really started again with the presentation by Alan Vanuk at ASCO 2016. Alan presented data from the CLGB SWOG trial, which is a large phase 3 randomized control trial comparing chemotherapy doublet plus cetuximab versus chemotherapy doublet plus bevacizumab. Now, Alan convincingly showed that patients with a right-sided primary tumor did have a significantly worse overall survival compared to patients with a left-sided primary tumor. Now, that in of itself is not very interesting, it's not very new. However, Alan also presented data that patients with a right-sided primary do benefit more from bevacizumab compared to patients with a left-sided primary tumor that benefit more from cetuximab. Now, in my humble opinion, this conclusion is a bit premature. We all know that patients in the CLGB SWOG trial, only about 55% of all patients in the CLGB SWOG trial did have the extensive mutational analysis performed, and hence it is well conceivable that patients with a right-sided cancer did have a BRAF or an NRAS mutation, which we know these are resistance mutations, and these patients do not benefit from EGFR antibody. Hence, the data is a bit premature, and hopefully the session on metastatic colorectal cancer in a few hours from now will shed some new light on this interesting and intriguing issue. Now, one study I was quite disappointed with was the GOLD randomized controlled trial. The GOLD study is an all-Asian randomized trial randomizing gastric cancer patients progressing after first-line treatment to paclitaxel weekly plus olaparib, a PARP inhibitor, versus paclitaxel weekly plus placebo. And this phase 3 trial was based on a very promising phase 2 trial that was published in JCO last year that showed a tremendous overall survival benefit from for patients receiving paclitaxel weekly plus olaparib. However, the phase 3 data was negative. The overall survival was numerically a bit better, 6 versus 8 months for patients receiving paclitaxel plus olaparib. However, this is yet another example of a tremendously positive phase 2 trial, which then pans out to be negative in the phase 3 setting. Now, for me, one of the highlights here at ESMO 2016 is really the advent of liquid biopsies in metastatic colorectal cancer. Liquid biopsies do help us to understand better the clonal variability of metastatic colorectal cancer. Liquid biopsies will help us to change treatments, to detect new driver mutations early on. And although the data is still a bit premature, liquid biopsies in metastatic colorectal cancer are here to stay and hopefully will be implemented in clinical practice in a few years from now.